Are you someone who suffers from incontinence, from overactive bladder, interstitial cystitis? Are you one of the more than 200 million people around the world who are suffering with this horrible bladder condition that can be embarrassing at times? Have you been going to different doctors, different clinics, different hospitals, and not getting answers? Has this bladder condition that you suffer from for weeks, months, or even years, has it robbed you of experiencing birthday parties, experiencing intimate times with your loved one? Has it caused you to be embarrassed in front of business associates? Has it caused you to miss out on certain other family experiences and family trips because you're literally tied to the bathroom? Are you wearing diapers or pads on a regular basis because you're embarrassed that you're wetting yourself? If you're one of more than 200 million people around the world who are recognized by the World Health Organization as of 1998 to have a bladder control disorder, then you deserve to watch the rest of this video, because you can become stronger. You can overcome your bladder disorder, and I'm here to help you. In the first part of this video, you're going to see a testimonial, an incredible testimonial of a patient who comes to me from the Bahamas with her daughter. They spoke for a pretty long time. I shouldn't say long, just really expressed so much incredible pain and anguish that she suffered for years, and how now they're just overwhelmed at how just incredible she's feeling. And she has no more for years her incontinence, zero incontinence for about 3 to 4 months now. Zero incontinence. She has total bladder control again. She doesn't have to wear any diapers or pads. She's not wetting her bed anymore. She's not wetting her legs anymore. She's not wetting her pants anymore. Total control. In the second part of this video, you're going to sit back and listen to me describing some unique exam findings to help you understand the different kinds of infections and toxins that can get into different parts of your nervous system and other parts of the body that can lead to a bladder control disorder. It's time for you to begin to finally understand what's driving your condition and be able to really get better. In the third part of the video at the very end, you're going to see some other videos that I'll put up here of other kinds of bladder disorders like interstitial cystitis or just an overactive or bladder pain syndrome, which I work with. And you're also going to see some other custom thumbnails of videos that are on my YouTube channel that'll help you really see that you can get better through other patient experiences. You can hear from other people of the joy they're feeling, the relief that they're experiencing. Okay, if you suffer from an overactive bladder, a leaky bladder, interstitial cystitis, you deserve to listen to this video. With me right now is a great patient and her daughter. This is Miss Knowles, and they come to my clinic from the Bahamas, right? Mm-hmm. Yeah, so one of your symptoms, which we'll start with, though, I think one of the worst that we'll start with, and there's a few different symptoms that we're going to cover here, but one of the worst symptoms was your overactive or leaky bladder.
Right, that's right.
So the leaky bladder, if you can just tell what it was like. I mean, was it just a spot here and there that you had to clean up after, or was it even worse than that?
It was pretty bad. You know, like if I wanted to go to the bathroom and if I don't go right then, it's pretty bad. I would wet myself before I get to the bathroom, or if I lay down like maybe 5 minutes longer, you know, it would come out, it would wet the bed, and I would have to go to the bathroom. By the time I get to the bathroom, it's all down my leg.
It's all down the leg.
Mm-hmm.
And how many years did you, that's terrible, how many years did you suffer with that leaky bladder condition?
That's a pretty long time. I don't remember the exact amount, but it was long.
Long, do you think more than a year, more than 10
No, it's
years?
more than a year.
Yeah.
When I was sick like over 14 years, so it all comes together with the 14 years. So with the leaky bladder, I wouldn't know exactly the amount of years, but it was pretty long.
Pretty long, but more than 10 years.
Yeah.
More than 10 years.
Yeah.
And it was more than 10 years of that severity that you'd have to go to the bathroom, and it would start leaking out on the way to the bathroom.
Uh-huh.
And leaking in the bed.
Yeah.
And that would happen every time.
Every time.
All day.
Yeah,
It can happen all day.
all day. But mostly more than the night during the day. You know, it's like every hour I'll have to go to the bathroom, you know, and it stopped me from having a good night's sleep.
Mm-hmm.
Yeah, and the day wasn't as bad as the night. You know, every time I lay down, I would have to get up and go to the bathroom.
Wow.
Yeah.
Did you feel pain in there, or did it just feel like the bladder was full and you had to release the bladder?
It was no pain. It just was full,
Oh.
and yeah, sometimes like a pressure to the bottom of my
Mhm.
stomach. So I would have to go.
Mhm. And now, after your first protocol, and you came to me in August of 2018, and you just came back to me now, it's February of 2019, and in one visit, 2-month treatment, what's happened with your bladder now?
Wow, I was able to sleep. I get up once a night. I get up like maybe around maybe like 1 or 2 o'clock, and I'll use the bathroom, and it's no more until I wake.
And no more. So one time a night instead of every hour.
That's right.
And is there any leaking when you do get up to go to the bathroom at night?
No,
Zero.
no,
100%
no,
control.
no leaking.
No leaking. And no wet bed, no wet pants, no wet underwear, no
No.
wet legs. Gone.
It's gone.
How many, and that's every day, all day, and how long has it been, right, every day and all, I'm not putting words out there, I'm saying I'm just repeating what you told me when we first discussed it, is that it's every day, all night, you have no more leak.
No more leak.
Zero.
No, I can
And
go all
how-
day.
Congratulations. It can happen.
Hmm.
And how many doctors, how many places did
Wow.
you travel to for this bladder control disorder?
It's a lot. It's a
Too
lot.
much to name.
Too much.
Really too much. Like, we've been to Cuba. We've been to a few doctors right here in Florida. We have been to Houston, Texas. And there's been no real results. You know, the results, like whatever they did, whatever treatment that she got, whatever treatments that they did, everything just lasted like maybe a week. Sometime maybe 2 weeks, and then like the whole symptoms come back, you know. And then there have been days where she, you know, she just lays there and cry. What's going on? Why can't they get it fixed? Why can't nobody figure out what's going on? You know, so right now it's a little bit unbelievable that from the time that she came in August, we have seen a lot of changes, you know. And like I said earlier, we know it's a road to travel, but just the amount of changes in those few months, it's, you know, it's overwhelming. It's changed her life a whole lot from where she was at to where she's at now. And well, I'm her daughter, as you would have already known, and I've been through it with her. I've been to Cuba with her. I've been to Florida with her. I've been to Houston with her, and it's, you know, constantly back and forth. And I'm always looking at the doctors like, really, we're gonna do this again, you know. So right now, to see the results she's gotten in such a short period of time, it's fantastic. One, it's relieving on me too, you know, because it takes a lot of the worries as to, you know, can we really find the help that we really need to get her to where she needs to be, you know. And thinking about coming from those days when we would have actually celebrated when she could sleep 2 full hours, or even sometimes when she could sleep 1 full hour and really got sleep, to now being where I have to be like, time to get up, you know. So it's like I say, it's great that we're now seeing the change.
Awesome.
It's like, it's brought me to tears over and over to see how she's improved so much from where she was to where she is now, and just the hope and knowing that it's eventually gonna get better, you know, and understanding that things may happen, but just to see the improvements as we go along, and see the improvements experienced in the period of time that she's come to see you to where we're at now, it's wonderful.
Yeah.
You know, it's overwhelming, it's relieving,
Yeah.
you know. And I know more than anything, this is about the happiest she's been in a very long time.
Awesome.
Yeah.
I'm glad to see your smile. That's great. Thank you for that.
Yeah.
I know it must have been a very difficult journey for the past
Yep.
14, 15 or so years with the suffering.
It has.
And doctors who didn't know what to do. And you've had reason, yeah.
it's been like diagnosis after diagnosis where, you'd have a chiropractor would tell you it's just like an alignment issue,
Oh, it's the nerve.
or it's a nerve issue. We've even been to a doctor where they told me, they said she needed to get a surgery done on her nerves, and I refused. And I told her, I'm not leaving you. I'm taking you home. I don't agree with it. I'm not a physician. And she was upset, but I felt like I was doing the right thing at that time. And like right now, today, we joke about it. Like, what would have happened if you had really done that surgery? To come to find out that it wasn't a nerve issue. It's just that other things that are going on in your body that nobody never really knew. And then to see that the treatment has resolved so many outstanding issues all at once. It's why we feel like it's really something that really works.
Yeah.
And I know we're doing a video and it's not pre-planned, but I would say to you, if you're suffering, try it. I would say to you, if you've been through half of what we've been through, where she has been to eating baby food, she has been to having spasms, she has been to having little mild strokes, she has been to the point where she really couldn't walk, she has been to the points where her hands were like full of little black spots. Her hands, her feet, and everything full of black spots. Look at it. It's it's back to like where my hand is. Somebody that's really been through a lot. So seeing the improvements right now, it's wonderful.
It's wonderful. And it's not unbelievable. It's just it seems too good to be true, but it's remarkable.
It's relieving,
It's relieving.
because you now feel like you're making some progress,
Yeah.
and spending the money, and it's like it's overwhelming that you always gotta spend it, and you're not getting any results from it. So what are you doing? Is it making any sense? And there have been points where she really said to me, I just want to go, just put me out of my misery, And to see where she's at now, it's
With every effort.
it's worth it.
And it wasn't a hard protocol.
No, it was
it?
very easy.
simple.
So very easy.
And all of a sudden it
simple.
just started to change.
Very easy.
Others, thank you for all of that input. I appreciate you telling people that. I'm going to mention some other symptoms. We'll just highlight these.
Yeah.
And then if there's anything else you want to say. You said that you had constipation for about 8 or 9 years.
That's right.
You weren't going for once every maybe 2 or 3 days. You might have gone.
And when I do go, I have to take something for me to go. I never go
You couldn't go without some support.
without taking something. And
And now,
now I goes every morning.
every morning,
Every morning.
with no help.
With no help. It's not twice a day yet. But I would love for it twice a day. But
coming.
once a day is better than
That's
nothing at
coming.
all.
It's coming.
Mhm.
You'll get there. So that's phenomenal. Constipation of 8, 9 years is gone, and no more assistance to get her to go. No other herbal formulas.
No.
No drinks. There's no enemas. There's no massaging the belly. There's nothing. And now we're fixing why. We're actually removing the
Right.
causes that nobody ever found. You had headaches for quite some time. And
Right.
those were every day?
Every day.
How many years?
Sometime
How many years?
for a
like?
whole week. Sometime I have to go and lay down just to be balanced so I don't fall down. But it was like every week constantly.
And now?
Now I don't have any.
How long has it been since you have no headache?
A little over a month.
Over a month. How long has it been since you've had no constipation?
A little over a month.
How long has it been since you've been able to control your bladder and have no leaking of the bladder?
Oh, a little over a month.
More than a month.
It's
Yeah.
been
And
more
it's
than a
just-
month.
Yeah.
It's been more
It's
than
been-
a month.
Yeah,
It's been like from around November,
Yeah.
to be exact.
So we're looking at 3 months now.
Yeah.
We're looking at 3 months of these results sustained.
Right.
That's the important thing for people to know, is that we're actually getting rid of the reason why the hidden infections
Yeah.
and toxins in different tissues, which you'll see in another video that's going to be blended in with this video, merged in with this after this discussion with these ladies. But it's sustained for about 3 months because we're removing the causes. Thank you for putting that in. You also had a tightness in the foot that you said is gone.
That's gone.
You had a rope-like pain around your legs.
That's gone.
That's gone. you weren't able. So again, you said the insomnia. You didn't use the word, but you're sleeping at night now.
I'm sleeping.
You get up once to go to the bathroom, and there was also, you said that you had like a jumping foot that was going on as well, a restless leg kind of jumpiness. Does that look okay?
Yeah, it's about, normal. It's, it's not as 100%, but it's better than it was.
And the stomach pain, the last topic is the stomach pain you had was, and I know your daughter, I don't know if she wants to jump in again because she's been so good at sharing with people, but the stomach pain was, you told me it was so severe you couldn't even sleep at night because the stomach was hurting so much.
There's been, for example, like when we went to Houston, the doctor that we saw there, he did some treatment and he gave some remedies, and then he told us, she had to get away from the fruits altogether. No fruits, no fruits, no fruits, no fruits. And then we were prescribed some, to use the Himalayan salt. She were told to use that on a regular. So it was like we went to the doctor's office, we did what we had to do, and then we went home, and she felt pretty good that day, after some of the chiropractor, the body massages and everything. And then, like, we said, okay, so we're in a foreign town, let's do some shopping, let's get around, and we did. And we stopped and she got a healthy sandwich. She got a nice healthy sandwich because at that point she never ate meat. And that's why we don't understand why she was still sick to the extent that she was. And basically, to cut a long story short, we got, it was what they call like a green drink that they made for her, and they put a food in it. And that night, she went home and we couldn't sleep. And like, we didn't know what went wrong. And then it was like, we went right back to the point of where we had to start using a hot towel in the stomach to get the muscle jumping and the cramping and everything to calm down. And it went away when we went back to the doctor the following day. It went away. And then like she was okay, no fruits, because that's what he told us the remedy was, no fruits. The fruit juices was the issue. And then we went back home and we started following what the doctor said in its entirety. Didn't miss a step, didn't miss a heartbeat. Regiment. And the problem persisted. We went back to the heating pad on the stomach. We went back to the enemas. We went back to everything just went back to normal, because like I said,
not normal
earlier,
but it went back to your original.
Just when I say normal, it went back to the normal pain coming back, the regular pain coming back. Then you have the regular spasm, and then no matter what she eat, at the end of the night she can't sleep, or she only sleeps for like an hour, and then she's back up. Then she uses the bathroom, and then she start having the churning in the stomach again. And then I'll be up like, what happened? Why is it happening again when we would have already gone through this? So now to see that just with the protocol that you've given her, the stomach has calmed a lot, and she has moved back to one of the family islands in the Bahamas. And I call her repeatedly, and I'm like, so how's the stomach? Oh, I don't even want to think about that. I ain't had that in so long. Let's just not talk about it.
About the bad things.
Just forget about it.
Yeah.
And so, honestly, I can say that from like about late October, November, consistently, she has not had the pain. She's not had the irritating muscle issue that she's been having. Because she always explained it as it feels like somebody's in her stomach just doing this, and it kept her up. And then there were points when, I would go and I would help her massage her stomach when she used to have the pain. And you could feel it like something in the stomach just like continuously jumping, But now it's to the point where she's not even having it at all.
Excellent.
She's not having it at all. She's not having the pain. She can sleep in the middle of the night. Like she said, she gets up once a night. And I think she might have fibbed a bit when she said she gets up once a night, because she didn't get up last night at all.
Yeah.
So it's some wonderful improvements. It's been some great improvements, and we're gonna stick with it. And see if we could get 100%
Oh,
back
she's gonna
to,
be so much better after this
where
one.
she is, really, really functioning 100%. But I can tell you now, she's back into her gardening. She's back into her beaching like she used to be before. And she stays outdoors a lot like she used to be before. One time ago, she was more confined to the house because she was always in pain. So when the pain sits, she needs to be to the closest sofa or to the closest bed. So then now she's even, like on the island, they'll go to the far north side on the beach and they'll sleep overnight. She can go back to doing that now. So it's happening. And then when I'm saying, you're sleeping out tonight? Yeah, we're sleeping on the beach underneath the blanket. Things that hasn't happened in years.
Celebration.
Yeah. It's modern celebration time,
Excellent. Thank you for sharing so much.
It's been wonderful.
I'm happy to be part of your team to get her to recover.
I'm happy that you are.
It never would have happened.
Yeah.
Now it's happening.
Yeah, it is.
Congratulations.
It is.
Thanks to you.
You're welcome. Okay, thank you. Stay tuned for the next video. It is just incredible to see tears of joy and almost in disbelief that she's been feeling so good for the past 3 months. It's just incredible, the results that she's finally experiencing, and she deserves to experience, and her family deserves to experience. I'm Dr. Lonnie Herman, and in this part of this video, I'm going to share with you the unique exam findings which I discovered in her first examination, which was on August 28th of 2018. And that first examination where I produced a very unique protocol with very unique specific remedies to help her clear up these specific hidden infections and toxins from parts of her central nervous system, her stomach, her intestines. You can hear about that right now. And then in a few minutes from now, you can hear the second evaluation, which was done on that day, which was February 13th of 2019. 5 months just about after she had started, 4.5 to 5 months after she started treatment with me. This second examination, we're going to get into other tissues of the brain and the body and discussing what kind of unique exam findings of hidden infections and toxins that when we remove those infections and toxins, they're going to help her get even stronger and even better in function and clear up the remainder, hopefully, I should say, clear up the remainder of all those symptoms. When I say hopefully, that just means I don't know if there's another couple of other infections or toxins that we're going to have to clear up as I move along in this journey with her to help her regain her function and feel years younger. She's feeling younger. She's able to enjoy her life again, as you just heard. So let's get into this first examination. In this first examination, I discovered areas which I'll mention right now in her stomach. There were various infections I'll talk about in just a few minutes in the stomach. We're going to talk about the small intestine in just a few minutes. We're going to talk about an area where the stomach meets the small intestine which had an infection. We're also going to talk about the meninges, and we're going to talk about the meninges and two different layers of the meninges. The meninges are like a coating around the brain and spinal cord. Not like I should call them, really, they are a coating, sort of a skin, if you will, protective 3 layers of protection around your brain and spinal cord, and they're directly connected into the brain and spinal cord through blood vessels and nerves. And we're going to talk about an area in the brain, and we're going to talk about the brain stem. And you're going to understand a very different level when I talk about these findings, a very different level of understanding of being able to dig into, so to speak, these tissues and find out what's really stressing them. And understanding the connections between the nervous system and the bladder, the nervous system and the lymphatic system, the nervous system and the organs and the cardiovascular system. We've got to understand the body's not one part. It's not about just the bladder. You've got to understand there are parts of the body that help to regulate the bladder function. And when they're doing cystoscopies or they're doing endoscopy tests or they're doing any kind of bladder installation test or they're doing Botox injections or they're just telling you to wear a diaper or they're giving you some pills or whatever they're giving you, when they can't find out why you're suffering and they don't understand the connections of different parts of the body to the bladder, you're going to continue to suffer. So it's not just about her bladder, but she also had incredible, serious, severe stomach pains and headaches since she was 15 years of age. Gone. We're doing incredible work. So let's get into this first. I will talk about her stomach and then her small intestine, parts of the digestive system, and then we'll get into the nervous system tissues. I found with her through this very unique bioresonance manual, hands-on, no computer program, no machines here, bioresonance testing that I perform in my clinic, which I've expanded upon. I've got a very unique system that I've created where I can actually bring in different kinds of examination processes that can really help to really pick apart what's driving the body to not work well or function well and help you to overcome your condition. And what do you like to be able to overcome your condition now? So listen in. In her stomach, she had a dengue fever virus, most likely mosquito-driven illness. Mosquitoes carry around viruses and parasites and bacteria and maybe fungus and mold. And when was the last time you ever caught a mosquito and kept it alive after it bit you and sent it off to a laboratory and asked the laboratory to be able to test it and find out which kind of viruses or parasites or so on that it just injected into your body? You probably never did that. So I'm not being wise there, I'm just being serious that you can have illnesses in your body that have manifested for years, infections that have grown for years that have now manifested into a certain kind of serious health condition that you're dealing with, that you're experiencing, that you're suffering with, that maybe even times cause you serious emotional stress and embarrassment and just taking away your life from you. So we've got to understand that these infections can come from many different ways. Mosquitoes are one way. She had the dengue fever virus in her stomach. She had a bacteria known as Coxiella burnetii in her stomach. It's also called Q fever or query fever. She had Lyme infection in her stomach. She had St. Louis encephalitis virus and the West Nile virus in her stomach. Right in the stomach, causing the stomach stress. Furthermore, when the stomach is stressed and can make stomach pains occur, the stomach is connected to the brain. So when the stomach is stressed, it can stress the brain. When the brain is stressed, it can stress the bladder. Stomach stress can cause a headache to occur. Stomach stress can cause a back pain to occur, or shoulder pain, a foot pain. Anything can happen in the body from these different hidden infections and toxins in the stomach and any other tissue, whether it's your liver, your pancreas, your intestines, your kidneys. Many different types of disorders can develop in the body. Symptoms can develop that are often evading even the finest kind of medical testing that's out there. I also found 2 kinds of mercury in her stomach. One of them was from her dental work, where she had mercury in her teeth, and the other is probably coming from either parts of the ocean of eating certain fish or shellfish, as well as maybe it was in a vaccine. That's a possibility of that kind of mercury. And I've got 10 different kinds of mercury compounds I can test people with and find them and help to provide remedies that will remove those metals from the tissues wherever they're located. Furthermore, I found in the pyloric sphincter. The pyloric sphincter is a sphincter. It's a muscle that's right at the base of the stomach that opens and closes when we're going to drop the partially digested food from the stomach into the small intestine. The pyloric sphincter, and when it's infected, it can cause stomach pain, it can cause bloating, it can cause a number of different symptoms in the body, even make the stomach, again, as I said, abdominal pain, head pain. It can even reflex a pain to another part of the body and make another type of disorder occur in the body to another organ that's connected to it. So the pyloric sphincter, she had the St. Louis encephalitis virus. That's another mosquito-driven illness, just like the West Nile virus, just like the dengue fever. St. Louis encephalitis virus affecting her pylorus, as well as the West Nile virus affecting her small intestinal mucosa. And that small intestinal mucosa layer helps us to balance our blood sugars. It helps us to absorb nutrients. It helps us to just feel well and having good balance of good bacteria. We've got to have the small intestinal mucosa layer healthy. Viruses can damage it and affect your body's ability to absorb nutrients. Viruses can damage it and cause pain and bloating. Viruses can damage it and cause the pain to actually refer from the gut up to the brain. And further. So you've got to understand we've got to be able to find these different infections and provide safe and effective remedies to remove them from the tissue so that we can actually let the body start to settle down and help you overcome these various symptoms, including, as you heard from her incontinence, which is beautiful for her to experience this now. Furthermore, I found in her stomach, last part of the digestion in this first exam, I found the influenza virus in her stomach. Yes, the actual influenza virus was in her stomach, stressing her stomach, and who knows how many years it was in there for. And you can have the influenza virus in any part of your body, and that does not have to make you feel, I've got the flu, I've got a cold, I feel feverish. You can have an infection that's existed in your body for so many years, which now has weakened your immune system. You're not showing the symptoms of the flu, kind of cold, feverish, achy body, I want to just be in bed and I don't feel well kind of feeling. You can have an infection in your stomach of the flu virus that's making your stomach not work well or feel well. You can have the flu virus in your liver. It can be in your pancreas. It can be in your brain. It can be anywhere in your body. Now, let's get to the central nervous system from this first protocol. That brought her that incredible relief you just heard from her. I found in the coating around the brain and spinal cord, as I said earlier in this part of this video, in her meninges. There's 3 layers. We're going to talk about 2 of them. The dura and the pia layer of the meninges. There's 3 again. So the dura and the pia, the outermost layer, the innermost layer, these have direct connection to the brain and spinal cord. And just think about this for a minute. When a woman goes in to get an epidural injection for, let's say she's giving birth or has some back pain, or a man has back pain and gets an epidural, but let's go with the birth process. When a woman's going to have a C-section or doesn't want a C-section but will do a vaginal birth, but they decide to numb her because she might tear a little bit or a lot, is that the epidural is not injected into the spinal cord. It's injected above the outermost layer of the protective layer around the spinal cord and brain, called the dura layer. Epi above dura, the dura layer of the meninges. It numbs the waist down. So what's going to happen when there's an infection that's in any one of these 3 meninge layers? It doesn't have to make you have a fever. You don't have to be going blind or need to be in the hospital. She had in her meninges the St. Louis encephalitis virus. She also had in her pia layer, she had the dengue fever virus, another mosquito-borne illness, and she had the rotavirus affecting those meninge layers. Okay? So we provided remedies to remove those infections from the tissues and help to strengthen the tissues. In her brain, she had the influenza virus and the Epstein-Barr virus. So those viral infections in the brain, they can cause headaches. They can cause the brain not to be able to control the bladder properly. You ever think about that? When you went to your urologist last time about your bladder control disorder, did they ever tell you, well, maybe there's a problem with your central nervous system, and they were able to check into it and find what it was and remove it and get you better? Or just sent you off on your way because they ran multiple tests like an MRI, or they ran a CAT scan, or they took an X-ray, or they did some cystoscopy or cystoscope, or they had some bladder release time kind of, checking how much urine's coming out over a period of time. Great. We've got to be able to understand the body in a different way and get you the results that you're looking for. And that's what I intend to do for you. I found furthermore in her brainstem, there is an inner part of the brainstem known as the reticular formation. The reticular formation is really important tissue within our brainstem that helps to regulate all sensory, just about all sensory, and just about all motor control from the brain to the body and the body to the brain. And it also helps control the bladder reflex. One of many things that it does, one of dozens of different jobs that it has. I found in her reticular formation, she had the general anesthesia substance called propofol. When they put you to sleep for a procedure, whether it's a colonoscopy or endoscopy or some surgery, where does that general anesthesia chemical go? When you wake up, you come out of the procedure, where did it go? If you took a white t-shirt, think about this for a minute, just picture this in your mind. Take a white t-shirt, put it into the bathtub, and in the bathtub you already had water with a blue dye. The water was blue. Put the white t-shirt in, take it out. What color is that white t-shirt now? It's blue. Let it dry, let it drip dry on a hanger in the shower overnight. Maybe 2 days, it's dry. Go ahead and wear it. Go in the sun. Get out of the sun, end of day. You're sweated in it throughout the day. It's still blue. Put it in the washing machine. No bleach, just put it in the washing machine. When it comes out of the washer, put it in the dryer. Comes out of the dryer, it's still blue. The dye doesn't leave. What chemical, you are what you eat, what chemical gets into your body and all of it just leaves your body? Don't believe it, that it just happens. I'm not knocking the drug companies. I'm glad that they have that chemical to help put us to sleep when we're having a certain procedure. We need it. Just understand that some of your malfunctions in your body can occur because maybe you have this general anesthetic as part of your central nervous system tissues now, and it's making those parts of your central nervous system tissues malfunction. Makes sense, yes? Yes, it does. I also found in her brainstem she had lidocaine. Lidocaine is a local anesthesia chemical like what a dentist uses inside the jaw to numb your mouth. Where did that chemical go when it wore off? When you could feel your mouth and tongue and cheek and jaw and tooth again after the dental procedure was done, where did that chemical go? Because your mouth is no longer numb like an hour or two after the dental procedure. Where did it go? Did you just breathe it out? Do you think that it left because this is not numb in an hour or 2 hours after the dental procedure? Do you think when you went to the bathroom and you just voided or you released some urine that all of it came out that way? Maybe some of it did. Did you ever think where it went? Maybe some of it stayed and stained, literally, part of your brain or your central nervous system. Remedies were provided to remove all of these different infections and chemicals from her stomach, her pyloric sphincter, her small intestine, her meninges, her brainstem tissue, the inner parts of the brain that I just mentioned. She came back to me February 13, 2019. And just to repeat what she said, and she and her daughter with tears in their eyes, she sleeps all night now. It's the last 4 months is what they said. 4 months she's been sleeping every night. No insomnia at all. Years of insomnia gone. Now she says it's rarely ever that she has to get up one time a night. She had the foot tightness gone. She had a rope-like pain around her legs gone after that first protocol that I just read about the exam findings to you. She felt tightness burning around the feet gone. Tingling that was in her feet gone. Years of these in her legs and her feet, these symptoms gone. She had constipation when she first came to me. She was going one time every 2 to 3 days. For 8 or 9 years, she had to use assistance. No more assistance. She's going every day. Every day she has a bowel movement. How important is that? Incredibly important. How amazing is that for her? You saw the look on their face. They're super happy. The stomach pain was a 10, went down to a 2 or a 3, only one time a week, if that, not even every week anymore. And now she's no longer wetting herself or her bed. She has complete control of her urine bladder. No more incontinence. Her headaches that she had since she was 15 years of age. 15 years of age. And we're talking a good number of years that she's had it, very long. She has no more headaches. They're gone. Gone. In this second protocol, I did a different unique examination, totally different. I used some different strategies. I found that she had 1, 2, 3, 4, 5, 6, 7 different mercury compounds. 7 mercury compounds in her right kidney. Kidney helps the body function in many different ways, including regulating blood pressure, including if there's any back pain. I mean, your kidney can be stressed, and the back can hurt, the leg can hurt, the foot can hurt. There's more to it than just releasing urine to the bladder. And I found a bacteria called botulinum, and the parasite known in malaria in her right kidney. In her left kidney, she had 3 different mercury compounds. 3 mercury compounds. She had less than in the right kidney, but in the left kidney she had the silver mercury compound, dimethyl mercury, and the thimerosal. Different amounts than what were in the right kidney. Her ureters. Ureters are tubes. I'll show you a picture here. Ureters are tubes that come out of the kidney. They run along the back and go down to the front of the body, to the bladder. The ureters, and there can be any kind of stress that happens in the body, not back pain, bladder disorder. There's a number of things that can happen when the ureters are infected. She had the botulinum bacteria. You know, they use that in Botox. What does it do? What do they do with Botox? They inject this bacteria called botulinum. It goes into the nerve and it paralyzes the nerve, so wrinkles go away in a person's face. You've seen somebody on Botox where they've had enough Botox injections, they can't even make a smile. There's no creases. There's no facial expressions. They can talk, but it looks like there's just like this face that they can't even raise their eyebrows. They can't make any kind of smile because it's paralyzing the nerve. What would happen if you were bitten by a mosquito and it had the botulinum bacteria and it got into your body? And it got into your kidney, got into your bladder, got into your brain. What's it going to do to the function of these tissues? Not good. I found in the renal pelvis tissue of her kidney, she also had the parasite from the malaria and the botulinum. I found she had both infections in her stomach and in the pyloric sphincter, back to that again, and in her liver. I'm going to take you to another part of the nervous system right now, which is something else, another part of her body that I found in her exam. In the cortex of the brain, we have an area of the brain up here. If we took off the skull, the top of the skull, which doctors have done, scientists have done, where they can actually cut a hole here, take off the cap, and expose the cortex of the brain. We'll call that the cerebral cortex, or the cortex of the brain. We have areas in this cortex of the brain known as the Brodmann areas. These areas represent parts of the brain that represent parts of the body. So what scientists have done for more than 100 years now, they could take a pin and stick it into a part of the brain. Nobody feels it in the brain, but they could feel it in their hand. They could stick it in another part of the brain. They don't feel it in the brain, but they feel it in their tongue. Another part of the brain, they could feel it in their bladder. Another part of the brain, they might feel it in their big toe of the left foot. The brain didn't feel it, but the body, where it represents from the brain to the body, that's where they would experience it. We have these upper motor neurons in the cortex of the brain. There's sensory and motor functions that come from this cortex of the brain. What would happen if you have an infection that gets up into the cortex of the brain? And yep, you can believe that there's a blood-brain barrier protecting you from everything. What makes you think that your blood-brain barrier is intact? What makes you believe that? Do you know, before I tell you about what I found in her cortex, do you know that the American Red Cross did a study in 2005. They went random, totally double-blind random study, any city, any state, any hospital, USA, any newborn infant, did not matter about the gender, race, or religion. 2005, any city, any state, any hospital, any newborn infant. The only thing about these newborns, they had to be born healthy, seemingly healthy. There was no leukemia, there was no cancer, there was no thrush, there was no rashing on the skin when they were born. They were not wrapped around their neck with the umbilical cord. There was no limbs missing. There was no Down syndrome. They seemed to be healthy newborn infants. They took biopsy samples before the vaccine, biopsy of the baby's tissue, a sample of the umbilical cord blood. They found 287 toxic cancer-causing chemicals in the babies at birth. 287. Pesticides, weed killer, insecticides, food preservatives, lead, mercury, more. I didn't even get more than 10 that I just listed. 287. They said a third of those, give or take a few, were neurodegenerative substances. Babies were born with them. It wasn't just like in Flint, Michigan, as you've heard about lead in the water there. Anywhere in the USA. And that can happen anywhere in the world. Okay? So when these chemicals are in the body, and they did not check for infections, viruses, and fungus, and bacteria, and parasites, and molds, and so on, bacteria, they did not check for those. But what makes you think that your blood-brain barrier is intact? What makes you think that when you get a numbing agent that goes into the mouth, that's not enough to breach that blood-brain barrier? Maybe yours was intact in your first dental procedure. I'm not knocking dentists. We need them. I'm not coming down on dentists. I'm just telling you that when you have chemicals that get into your body as you go on your journey, it's decreasing your body's ability to protect itself. We have to find those and get them out of you. And that can be done. I found in the cerebral cortex, the cortex of her brain, black mold, stachybotrys. Remedies are provided for her to get rid of these different infections and these chemicals that I found in this round. Okay? And we're going to see her again. This protocol, 80 days, I'll see her again. Pretty incredible what she's experienced so far. I believe that I've got the right tools, knowledge, and skills to help you get well too. You've got a great chance to overcome your bladder condition, headaches if they exist in you, stomach disorders. You've got a great chance. There's no reason to keep going on with your bladder control disorder or any other symptom in the body. It's time to get down to work, and it's time to be able to start to figure out why you're suffering. Follow me on Facebook. I put up posts there on a pretty regular basis, so you can scroll down and look at my Facebook page and see some things I posted. You can also go to my Instagram and even on Twitter. And also, you subscribe on my YouTube channel. You'll be the first to know, the first to get an email from YouTube telling you that I put up a new video. And I've got a lot of different videos, a lot. I've got probably around this time, maybe close to 300 videos on my YouTube channel. There's some incredible patient recovery testimonials, videos that I've put up on this YouTube channel, and other videos where I've described in great detail about different kinds of conditions like Parkinson's and lupus and multiple sclerosis. I've got an incredible video about an MS patient who had a bladder control disorder. She doesn't have it anymore. She had it for years. It is now gone. Okay? You can get well. It's time to start to go through the process of getting you there. It may take more time. The speed of recovery varies from one person to another. It may take you more time than it took her. This is living proof that I just showed you. This video from her is living proof that somebody can overcome this bladder disorder. Again, there's going to be videos coming up in a few minutes. You might want to pause and maybe write down some names, and I'll even put some links below. When you can scroll down below my video here in the YouTube video information, I'll put some other video links up there that you can click on and watch and get a deeper appreciation for what other kinds of exam findings I've discovered in other people and other parts of the brain and central nervous system and so on that we've got to be able to investigate and test and to figure out what's causing this stress and help you overcome your bladder control and or stomach and or headache and any other pain in the legs, as you've heard with her, but to overcome this bladder disorder. Okay? You can call my clinic at 954-370-3100, 954-370-3100 now, and you can help yourself to make an appointment for yourself or a loved one to now get an appointment with me. And by now you should really understand or be able to embrace by now that you can actually help yourself, that there's a chance to overcome it. So by now you can just call at 954-370-3100. You can even send an email to my clinic assistant. I'll put that email address up here on the screen as well. You send her an email. We have people coming in from all parts of the world for this unique work that I perform. Okay? It's time to get better. One more thing. Just so you know that insurance companies don't recognize the type of work I offer. This will be an investment in yourself or your loved one. Okay? It's just what it is. Unfortunately, they just don't recognize the kind of procedures that I offer, so there's no way that I can bill them. I look forward to helping you. See you soon.